Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio, where we provide actionable health information on a week-to-week basis that can help you improve your life. Feel free, head over to justinhealth.com, where we have various opt-in video series on more in-depth health topics such as female hormones, thyroid, and gut health. Also, while you're there, feel free and schedule a consult with myself, Dr. J, and or my colleagues. We're available worldwide to provide natural health support for any of your major health issues. Again, welcome to the podcast and enjoy the show. And we are live. It's Dr. J here in the house. Evan, how are we doing today, man?
I'm doing better. I had COVID, believe it or not, and that was like a 5-day journey. I think I'm over the hump, so if I sound a little weird, that's why. But the family's healthy, and I'm a survivor now. I'm going to be in the, quote, recovered category.
Recovered category. Love it. That's good. Excellent. Well, today we chatted kind of pregame that we wanted to talk about fertility, talk about natural ways to enhance fertility. We see lots of patients that as a side effect of getting healthier through natural medicine, functional medicine, good nutrition, diet, and lifestyle, they get pregnant, even if fertility wasn't a goal. And we have some patients that come in with the goal of fertility. And the nice thing is fertility is a byproduct of getting healthy. So, I mean, there's kind of two approaches to it. There's the conventional medicine side where they're not really making you healthier. They may just be changing some of the hormones in your body so you can get pregnant, right? i.e. via IVF therapy, those kind of things, right? And then there's kind of natural ways that we are utilizing the enhancing of health, the enhancing of physiology to get pregnant. And sometimes IVF may be necessary if you've done everything you can do on the health side and you're still not getting pregnant. That may be an option, right? But we want to do everything we can do on the natural medicine side, because if you do that, 80 to 90% of people, I think, are going to get the results they want, which is getting pregnant. So I'm excited to dive into this topic with you today.
Yeah, I would say that it's pretty rare to need IVF based on some of the people that you and I've seen clinically. I've had several men and women, and it's good as a couple, right? So that's the important thing to mention. It's important for the couple to get healthy. A lot of the blame is placed on the woman, but in many cases, male sperm motility or sperm concentration is a big issue. So the men kind of, I don't know why, but in general, the men get ignored in this conversation, but it's really important for them to get optimized as well. And we've had couples where they looked at the cost of IVF, typically 10 upwards of $15,000 depending
on 15, 20,000 really.
Yeah, okay, so 15 to 20. And people come to us first and say, well, we didn't want to go to IVF yet because of the cost. Cost was kind of their main motivator, and maybe they, hopefully had some sort of a natural-minded bias. And so they said, well, let's see what we can do first. And then 100 out of 100 times so far, we've been able to avoid IVF in those people. And we've had, between you and I alone, we've had 4 healthy children on our own, and then countless women that have had healthy pregnancies with our support.
100%. It's all about getting to the root cause, right? And there is that whole idea of the Pottinger cats experiment, where Pottinger was a medical doctor, I think in the 50s, and he had different cats, and he would feed some raw food, some processed food, and then there was, I think, within 3 generations of eating processed food, the cat group that ate the processed food lost the ability to reproduce. So there is this idea that we're on like the 3rd generation or so of this Pottinger cat experiment, and there are some people that are just at that end level where they may have reduced fertility just because they're living out the Pottinger cat experiment in real life. It's possible some of that is the case. So we want to do our best to really emphasize a whole food, nutrient-dense, anti-inflammatory diet. We know that pregnancy involves healthy hormones, and as a starting off point, we don't want to eat foods or toxins or hormones in our animal products that could throw off our fertility. So the first step in any fertility program, nutrient-dense, anti-inflammatory, low toxin, that's going to mean an organic whole food diet. That's going to mean cutting out hormones and antibiotics and pesticides and GMOs. A lot of these pesticides are xenoestrogens. They mimic hormones as well because they affect the insects from reproducing. That's how they kill them, right? And so it can also have an effect, a cumulative effect on women and men on the sperm count, women on the fertility side. So diet is going to be one of the first things. And the second thing is going to be blood sugar stability. I think this low-fat, low-cholesterol era, skipping meals, fad dieting has prompted lots of insulin resistance, lots of reactive hypoglycemia, meaning too much sugar, too much carbs, blood sugar goes up and then spikes down, which then creates this insulin surge. And high levels of insulin is really what's behind the leading cause of infertility in women, which is PCOS. That's polycystic ovarian syndrome. And that the mechanism there is high levels of insulin, insulin resistance, insulin surges, thus increase androgens. And then the androgens also can throw off prolactin, and then that can dysregulate a woman's cycle. So you can see there's a lot of different hormonal rhythms that can go off together and create many issues. So the major mechanism is going to be this insulin resistance, followed by increased level of androgens, free testosterone, and then also prolactin issues to boot. Those are kind of that's the big initial sequelae that we see. And of course, usually if they're eating a lot of carbohydrate and junky foods, people that are missing that level of awareness tend to also be consuming the pesticides, maybe going low fat, low cholesterol, maybe not getting high quality animal products, and they're getting all the hormones from there too. So that's like kind of my first two things out of the gates.
Yep, well said. And just want to quickly go over the conventional treatments for infertility, especially resulting from PCOS. That's what we did on our gut health podcast, kind of the conventional versus functional gut health. People loved it. I got a lot of good feedback on that, so thanks for the feedback. But it's not pretty. You mentioned it's not root cause, and it's not. So you've got this clomiphene, which is the American College of Obstetrician Gynecologists recommendation. That's their primary medication for PCOS patients with infertility. It indirectly causes eggs to mature and be released. And then you've got metformin, which we just talked about, the insulin resistance problem. So metformin would come in and help. They talk about it helping just in terms of ovulation, but that would probably be just due to helping to lower insulin.
That's what it is. Yeah, okay. Metformin and glucophage, that's a big one.
And then you've got the letrozole. This is a drug that slows estrogen production, causes the body to make more follicle-stimulating hormone, FSH, which is what you need for ovulation. And what else here? They've got just other hormones in shot form, which are going to cause ovulation. And then the craziest one, let me just read this one here, and then we'll move on into the functional. You've got ovarian drilling. And so the surgeon makes a small cut in your abdomen, inserts a long, thin tool, and they use a needle with an electric current to puncture and destroy a small part of the ovary. This surgery leads to lower androgen levels, which may improve ovulation. So, wow. And if you do all those and you don't get pregnant, then you could go to the IVF, which is where the sperm and the egg are put in a dish outside the body. Fertilization happens, and then they put the fertilized egg into the uterus, and then boom, there you go.
Exactly. Now, I kind of want to tie back to the root cause. I want everyone thinking about fertility from a root cause perspective, because when you think about it from a root cause, then you can say, hey, are we getting to the root cause doing this procedure or doing this thing? So first off, like I already mentioned, PCOS is a big one. Now, with infertility, there's usually going to be some level of insulin resistance or blood sugar dysglycemia, meaning your blood sugar is up and down and your body has to make a lot of hormones to regulate that flow of blood sugar. So when your blood sugar goes really high, right, because of excess carbohydrates, imbalanced meals, not enough protein and fat, you're going to surge a whole bunch of insulin to bring the blood sugar back down. Now, in women that tend to be more on the heavier side, usually that blood sugar eventually starts staying higher because that's what diabetes is, right? Chronically high levels of blood sugar. But usually before that, there's some level of reactive hypoglycemia where blood sugar goes up and then crashes down because the body over-secretes insulin. And when the cells are still sensitive to insulin, that blood sugar will drop down really, really fast. And then your body has to make a lot of adrenaline and cortisol to bring it back up, okay? So if we tie in prolactin is going to go high when there's high levels of estrogen. So when we start having more estrogen dominance, okay, first mechanism, how does estrogen dominance happen? Well, it's going to happen, one, through exposure of estrogens in the environment. Two, it's going to happen through metabolism of progesterone. So progesterone is a really important progestational, pro-fertility hormone, very important. And when we get stressed, we'll actually convert progesterone downstream into cortisol. So when we get chronically stressed, we're going to decrease progesterone. And then number 3, high levels of estrogen dominance, that is going to start driving prolactin issues. And when we start burning up dopamine, right? Dopamine's a very important neurotransmitter. Dopamine gets used to make adrenaline. So when we start making a lot of adrenaline and a lot of stress neurotransmitter, dopamine gets used, and dopamine's a tonic inhibitor of prolactin. So imagine you have prolactin and you have dopamine level is like the foot on the brake, right? And as you start depleting your dopamine and you start getting more stress, you're taking your foot off the brake, and what happens to prolactin? It goes up. When prolactin starts to go up, one of the side effects is loss of ovulation, right? You can go amenorrhea. So you have a couple of mechanisms, right? You have this prolactin mechanism from dopamine. You have estrogen dominance, which can affect prolactin as well. You have this infertility through PCOS and insulin resistance and elevation in androgens, right? And then also all of the food components, all of the hormones and the toxins and the pesticides also contribute to that.
Yeah, those are, I would say, the biggest and most important things affecting your average American. There's a couple other small subgroups I want to mention in what I've seen with infertility. One being people that are overtraining with exercise. You mentioned the loss of the period. So I had a woman who she was in the small percentage, but we have to talk about the small percentage because, people who are healthy and want to be healthy listen to our podcast. And so there's people that may be overachievers, we'll call them. And so we had a lady that was doing CrossFit like 4 or 5 times a week, 45-minute sessions, and just beating the pavement. Now, typically when someone's doing that, we don't really need to run a hormone profile, but just because I knew that it would increase her compliance, if I told her to stop exercising, she may not listen to me. So we use the testing to prove on paper what we already knew intuitively, which is that she was causing her cycle to be disrupted due to the chronic stress of the overtraining. So when we ran the hormone profile and we showed her what her cortisol looked like, it was basically flatlined except for the time of the day when she did the exercise. She had a mild spike, which is why she felt better. She said, oh, my day's not complete until I exercise. That's because her cortisol was so low. And when she whipped the tired horse, all of a sudden she got this temporary boost of cortisol and adrenaline. She felt normal, and that was it. But the prescription for her to get pregnant was simply just go down in the exercise. I just told her do 3 days a week max, but do yoga, restorative, do biking, do hiking, do gentle things that are fun for you and fun for your family. And that's all she did. I mean, her diet was already dialed in. We did look at her gut. We didn't see any infections there. We knew that there was no insulin problem. The carbs were not an issue. And she got pregnant just by simply reducing the training. And then another small group of people are women specifically, that were just going too low carb. So I had several women that were on a ketogenic diet, and some would argue, well, our ancestors, they could have been ketogenic, right? They were out in the prairies eating the bison, and they may not have had access to potatoes and whatever else. But I do believe that some carbs are beneficial and necessary for fertility and for healthy pregnancy. So I had some women that were on keto for a long time. All we did is just add in some starch, organic white rice. We did some potatoes every once in a while, and boom, they got pregnant, and we didn't change anything else. This is, of course, after we do the whole functional medicine workup, which you and I will talk about in a minute. That was after we did all that. Then we tweaked the diet, and then boom, she got pregnant.
Yeah, and I would say because infertility is primarily driven through PCOS, and PCOS, the major mechanism behind it is going to be insulin resistance, I think a default template should be a lower carb, paleo, ketogenic template. But just because that's our default, it doesn't mean we're not clinicians and adjusting things for the patient. So, of course, with this girl, she may have done really well with that, and then she may have tapped out her benefits with it, and she may have already been at a really good place with her insulin. Because if you get insulin too low and you already are relatively healthy body comp, that could also be a problem too. So this is why we have to individualize it for patients. So we're talking about PCOS and insulin resistance, and for most people, that kind of a dietary strategy is going to be a really important starting point. But for some people, you may hit the wall and you have to adjust, like Evan talked about. Others, you may have to hang out there a lot longer. So just kind of keep that in the back of your mind, because we're kind of having two conflicting recommendations, and that's because everyone's an individual, and we have a starting point for most, and then we adjust according to the patient's needs after.
Yeah, and that's just an extreme case, but I at least wanted to mention it, right? Because you always have the people that say, "Well, I've already done paleo and I still, had issues." Of course, there could be other underlying causes, infections or whatever else we'll get into. But in her case, this is a lady who was literally just doing like meat and maybe a salad. She literally had almost virtually no carbs at all. So that's just an extreme manifestation. But if you're doing, like you said, just kind of standard paleo template, you're probably going to do, maybe it's plantains or some berries, or you probably eventually over the day would accumulate enough starch or carbs to fuel the fertility. But in her case, no, she was too low.
And again, if you're insulin resistant, the starch or carbs may be keeping you infertile, right? So we can always do testing. We can always run fasting insulin, and we can see where your fasting insulins are at. If there's PCOS, we may also want to look at prolactin. We may also want to look at free and total testosterone to see where that's sitting, to make sure it's not, in the top 25% of the reference range. That's pretty good to look at. So what's the underlying mechanism? So if this person's overexercising, it's probably, one, overexercising, it can create estrogen dominance, right? So it can decrease progesterone. It can also decrease your dopamine and adrenaline, which can be that driver that increases prolactin, right? And it can also just deplete hormones in general. I see a lot of women that are low estrogen, low progesterone, and they still may be a little bit in estrogen dominance because the ratio is still skewed, but their hormones are just low across the board. I see that a lot as well. So you have to, this is why it's super important to test, right? Because if you're not testing, you're guessing. So with fertility cases, we may run a month-long test to see where you're at from day one when you bleed, all the way to ovulation, all the way to the end of the month, looking through the luteal phase to see how high that progesterone gets. We may just come in there and run a snapshot on the luteal phase too. It depends. If patients have some infertility issues, but it's not a primary thing, then we may just come in there with the luteal thing. If they're really struggling on the fertility side, then we may do that full month. So I'll typically do one or the other. And of course, looking at the adrenals is so important. Why? Because the adrenals interplay with dopamine and adrenaline and cortisol and estrogen dominance, i.e. via progesterone going to cortisol. We have to look at the adrenals because they play a major role as a backup generator with the female hormones.
Yeah, absolutely. I mean, adaptogenic herbs are part of my life. They're part of your life, on a daily basis for us clinically and personally. And it's a game changer. I would say it's one of my most favorite and biggest tools that I will use with a woman who is struggling with infertility, especially because there's so much emotional stress and there's trauma associated with this, especially if a woman's had a miscarriage or if a woman, has worked on this for months and months and years and been to several doctors and practitioners, and she feels like she's at the end of the rope and she's aging and she's kind of running out of her fertile window anyway. I mean, there's so much stress associated with the emotional component of this as well, and the maybe family pressure, or when you're going to have kids and that whole thing. So to me, that's where adaptogenic herbs come in and not only help with the hormonal side, but the mental, emotional stress as well.
Exactly. So in general, like with women and men, similar things with the diet, right? Men, there's less of a hormonal fluctuation that's going to be throwing fertility off. So keeping the pesticides, the hormones, the artificial hormones, the xenoestrogens, the growth hormones, really emphasizing good proteins, good fats, high quality cholesterol from animal products, lots of good antioxidants from leafy greens, keeping insulin in check. That's a good first step. Of course, we can add in resistance training. We can add in mitochondrial nutrients like carnitine and CoQ10 and arginine and zinc and selenium. Again, with certain male patients, we'll come in, we'll run a nutrient profile and see what nutrients they're low in as well. Of course, we're going to be fixing the gut, fixing the adrenals, and using a lot of those first-line things. There's also herbs we can use as well. Ashwagandha is a big one. Tyrosine and dopamine is a big one, right? You see mucuna is a big one. Why? Because dopamine helps with fertility. You mentioned earlier, Tongkat Ali really helps with that upstream signaling from the gonadotropic releasing hormone, which then helps with FSH and LH. LH is really important for spermatogenesis and making healthy sperm. So these are really good first-line steps for enhancing male fertility. Anything else you want to add about that?
Yeah, we didn't press the record button yet when you and I were talking about that. So let me just give a quick little story on Tongkat. Yes. So Tongkat, Tongkat, Tongkat Ali, there's a Latin name for it as well. It's something that's beneficial for men. We give it a lot to athletes. It does help with testosterone levels, and there are a couple of really, really cool papers on it where it's increasing spermatogenesis. by influencing that HPGA axis, the hypothalamus pituitary gonadal axis. And long story short, not only did it increase the sperm count, but it increased the sperm motility. So you've got better swimmers. So when we talk about men, having an important role in this fertility, piece, that's also a game changer. And then tribulus is another herb. Tribulus is, once again, kind of used in the bodybuilding community quite a bit to help with muscle mass and androgen increasing effects and all that. But it does help with the testosterone and the DHT, DHEA levels, which are all sex hormones that are important. And then also, what about the influence of the gut? Do you want to talk about that now? Because I'm just thinking out loud with you here. We should probably talk about the mechanism of beta-glucuronidase issues with men and women, where they would be recirculating estrogen and having issues with estrogen due to the beta-glucuronidase enzyme being high due to like a bacterial overgrowth problem, for example.
Yeah, so in functional medicine, right, we may look at things a little bit closer when it comes to fertility, but we're still going to be doing the same things with the gut, because if we don't go to the 6 R's of healthy gut function, if we don't go to the 6 R's, removing the bad foods, replacing enzymes and acids, repairing the gut lining and the hormones, removing the infection, repopulating, reinoculating good bacteria, retesting, the gut is where everything happens. 80% of the immune system's there. That's where all the nutrients are absorbed and digested and assimilated and utilized. So if we just were to skip that and go to a hormone protocol or a cyclical augmentation program with progesterone, we may miss a lot of those nutrients getting assimilated, broken down, and absorbed and utilized. So we have to always assume the gut could be a major interplay. And again, most people, they're not connecting the gut with their hormones. They just aren't,
Never.
right? But like you mentioned, beta-glucuronidase plays a role in hormone detox. And we could be increasing estrogen dominance through the bad bacteria, causing us to reabsorb estrogens, right? We could also just have bad liver and gallbladder function because we're not digesting fat, partly because of low stomach acid, partly because of an H. pylori infection or Giardia infection, and that can make us hard to break down and assimilate cholesterols and essential fatty acids, which are important building blocks for fertility, right? So these things always kind of connect, whether they're 1, 2, or 3 degrees away from the root.
Now, if you're a little brain fogged and you're listening to Justin talk, you're like, oh my God, he's talking fast. What is he saying? Giardia, what in the heck? Pears, oh my God. So yes, literally, gut infections can literally make you infertile. We had several women who were infertile and we ran their stool panel. They showed up with parasites, whether it was Giardia or crypto. As you mentioned, H. pylori being a big influence on stomach acid. So now, if we think about, we always talk about good diet for mom, which is going to be a good diet to feed and grow a baby. But what if she does have these infections and she is doing a paleo template and she's doing her grass-fed whey or whatever to get her amino acid profile complete, and now all of a sudden she's got these gut infections. So literally, just by running a gut panel and walking someone through using herbs to eradicate these infections, boom. I lost count. Many women who, during a parasite protocol, they'll email the office, I'm pregnant, what do I do? And we're like, holy crap, yeah, by the way, this protocol, by eliminating parasites, it actually increases fertility. Boom, there you go, congratulations. And so it's pretty nuts.
It is pretty nuts. So in general, anything else you want to say about that? So we talked about gut being really important. So HCl, enzymes, those kind of things are really important. We talked about the 6 R's. We've done podcasts on that topic. So just make sure if you're thinking about fertility, make sure we don't ignore that, right? Half's going to be on the women, half's going to be on the men. Usually men are easier to deal with because they don't have a very unique symphony of a cycle. They kind of have a foghorn of hormones, and usually that's going to be depleted by stress and poor nutrition and gut stuff. So it's a little bit easier on the hormone side, but with women, it's a little bit more complicated because of the cycle. So we talked about IVF. We talked about medication like clomiphene citrate or Clomid, which is it stimulates GnRH, which then stimulates FSH and LH. These are follicle-stimulating hormone and luteinizing hormone from the pituitary, which then stimulate egg maturation and ovulation. So there's that, right? But that's kind of like a stimulator. Like, think of it as you got a tired horse. Do you really want the horse to perform by whipping it harder? Right? Is that the mindset? So for some people, that's like an easy, quick, simple, okay, I'm pregnant now. And most people who aren't as natural minded, that's usually the first line of therapy that they're going to do on the fertility side, right? Then usually after that, they may go IUI, which is intrauterine insemination, and then they may go into IVF, where they shut down the whole HPA axis using Lupron. They come in there with certain follistim and different hormones at certain times so they can grow the eggs, harvest them, put them back in, get the whole hormone cascade going with all the injections, and then voila, you're pregnant, and then maintain the pregnancy with progesterone. That's kind of what happens on the IVF side, but that may not be necessary for a lot of women. We already talked about the major mechanisms. Now, what are some deal breakers that may hold you back from getting pregnant even with doing all this? So there are certain things you have to look out for. Fibroids are a big one. If you have some big fibroids that are just hanging out, there could be enough there where it's disrupting blood flow, because the fibroids are a blood flow hog, and that could be preventing the egg from implanting into the uterine lining. Also, the fibroid can create a little bit of inflammation. Now, everything we're talking about is designed to help prevent those fibroids from growing. The question is, how long have they been growing there? If they've been hanging out for like years and years and years and decades, some of the natural things just may take too long. And so you have to be very, very aware of that. Or it may be so big where it has so much momentum, it may need to be removed surgically. So you have to be mindful of things like fibroids. Also, endometriosis is a big one. That's endometrial tissue, which is basically the endometrial lining tissue starts growing in areas it shouldn't be. It could grow on the ovaries. It could grow on the bladder. Sometimes endometriosis can cause inflammation in that area. And then a lot of times just a simple procedure where you come and take a laser and kind of laser it off can be very helpful. Conventional medicine won't fix the root cause of why the fibroid's there or why the endometriosis is there, but sometimes it's gotten so bad where that may be necessary. And there's also something called a chocolate cyst, which is basically endometriosis in the ovary. And that can definitely be a problem as well. So that may need to be drained. So that you have to look at some of these things, some of these tissues that have grown for a long period of time. They may need a conventional intervention. Now, as long as you're relatively young and you have some time, try the natural stuff first and see if your body can handle it. If not, that may be the next thing to look at. And then, of course, we already talked about PCOS, which is polycystic ovarian syndrome. And that's where there's cysts in the ovaries from all the things I mentioned, elevations in insulin and androgens. And I've seen those reabsorb time and time again. So I've seen the body be able to handle that. I don't see most patients, they don't have to go in and get those things drained per se. I find the body can handle that. The other things may need to be addressed at some point over time. But I always say wait and see, work with a good functional medicine doc, have a good OB-GYN or a reproductive OB-GYN kind of in your back pocket so you are monitoring things as you move forward. And if you have to go a surgical route, don't throw away the functional medicine doctor. Keep both of them working together.
Yep. Yeah, good point. And, it's possible that you could find like a holistic or more natural-minded OB as well. That would be good to have on hand. That way they would help support you with some of the dietary stuff. But yeah, with endometriosis, there's a hormone component to that as well. So we already talked about diet and things like that. But, of course, in the beta-glucuronidase, so like calcium D-glucarate, for example, that's something that we may use to help with getting out these excess xenoestrogens, and that could be a game changer too. And of course, in the diet, you're getting some calcium D-glucarate. You'll get some of that naturally in the diet. So whether you're doing like broccoli or blueberries or whatever, different cruciferous veggies, you're going to get some beneficial stuff like that anyway that'll help regarding the hormones. It sounds crazy that broccoli could help pregnancy, but it definitely could. And then also, I know there's various exercises too that can be helpful. Exercise in general is helpful. So, if you have a sedentary woman and you get her moving, but not to the CrossFit five times a week level, that could be a game changer.
Exactly. So you got to look at everything holistically. Like I'll tell you my personal story. We have 2 healthy kids, 2 healthy boys, and my wife and I had a hard time getting pregnant in that first year. And we found she just had a really, 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 really big fibroid, very big. And she was
that
on
an ultrasound, or how did y'all figure that out?
Transvaginal ultrasound. And my wife, before she met me, she was on birth control pills for over a decade. So I think there was that. She was eating a lot of conventional food in the beginning before she met me, before we tweaked her diet. So I think there was a lot of hormonal growth that was going on for decades that caused some of that growth. And you can't just pull it away and expect it to just reabsorb all of a sudden, right? You can't take 10 years and just expect it to go away. And so we actually tried reducing it. Now, there are things you can do that can work. There are You can do things like EGCGs, epigallocatechins in the green tea. You can do things like resveratrol and liposomal curcumin. And you could do systemic enzymes like serrapeptidase and lumbrokinase, which help to metabolize some of that tissue and can work. The question is, can it work fast enough? And so we went the surgical road. She got the fibroid removed, and literally within 2 months of it being gone, pregnant, no problems. And so sometimes that can be an issue. So you have to look at, okay, what's the root cause? Do we have some limitations of matter, right? Where this tissue's just been hanging out too long. Just the body needs a little bit of a head start getting that tissue removed. And if you got time, do the natural things and just watch and wait, right? Watch and wait. So if you're a female listening and you're not in a relationship or you're not looking to get pregnant anytime soon, but you want to at some point, I just recommend getting a good workup with your OB-GYN to make sure there are no endometriosis or fibroids. Endometriosis is hard. Typically, the only way to figure that out is laparoscopically. Little incision, put a scope in. So it's kind of tough to know that one, but usually a lot of the telltale symptoms, like the painful periods, like those kind of things, if you're having those symptoms, work with a good functional medicine doc to help it. But keep an eye out on bigger issues like fibroids and those things so you can act on it early.
Yeah, thanks for sharing the story. And now you got 2 little boys, and they're keeping you busy, so everything worked out.
You got it. Absolutely. So keep that in the back of your mind. Anything else you want to add, Evan, on the supplement side? I know you were kind of riffing on a couple of adaptogens earlier. Anything else you want to add? You mentioned Tribulus and Tongkat Ali.
Yeah, so that could be for the men. I would just say during the... You and I have talked about this idea before. We kind of call pregnancy more like a 4-trimester thing, which women like cringe at. Like, oh my God, isn't pregnancy long enough? But just meaning that there's a kind of a prenatal phase that happens before you even get pregnant, kind of a fertility supporting area. So we'll bring in multis and omegas, and like you said, maybe systemic enzymes. We'll bring in trace minerals, micronutrients, maybe grass-fed whey protein, maybe some organ supplements. I mean, there's a lot of things that we can do right away to kind of prep the body before you even get pregnant. It's not, I disagree with this idea of you got a positive pregnancy test, start the prenatal. It's like, no, you could be 6 weeks in already. Like, you should have been on the prenatal 6 months before you got pregnant, in my opinion.
Yeah, and most prenatals are more of a marketing thing. Like, in some of the prenatals that we recommend, what makes it a prenatal? Well, there may just be a little bit more calcium. There may be some extra folate in there. And, of course, everything's active folate. No folic acid. Everything's LMTH of folate. Of course, everything's methylated. There may be some extra iron in there, right? So there may be a couple little nutrients that are a little bit extra, but if you look at a really good high-quality multi versus a prenatal, they're going to be about 90-95% the same.
Yeah,
if you're getting a high-quality. Couple little tweaks here and there. Of course, you may want to add in some extra essential fatty acids, cod liver oil. Those kind of things I think are very, very helpful.
I get so mad when you go, like, if you go to like Whole Foods or, I mean, even a place like that where you'll go and you'll see these little cute gummies in like a clear container, and it's like 6 gummies a day, and the first ingredient's like fructose or fructose tapioca syrup, and it's like, okay, here you are taking the woman who, may not know exactly what's going on, may not understand the root causes, and here she is eating these little gummies every day as a prenatal. It's like, no, it's like candy.
Totally. I 100% agree. One other thing, if you have to go a surgical intervention, I recommend personally, if you're of fertility age and you want to get pregnant, that you see someone that has a specialty in reproduction as well as being a gynecologist. I find that certain gynecologists have a perspective on what's happening surgically with the goal of removing the tissue, while others have a perspective of that while maintaining fertility. So I find someone that's a OB-GYN as well as a reproductive specialist, they looking at the procedure with a lens of keeping fertility intact. So I always recommend, if you have to go the surgical route, try to find an OB-GYN that also has that reproductive specialty as well.
Yep, good advice.
Yeah, I think that's important. I've heard too many stories from OB-GYNs who don't have the repro specialty, and and again, some of these are older stories, they're too easy, they jump the gun on just doing a complete hysterectomy, or doing a partial hysterectomy and just removing the uterus, or just removing too much tissue, and that scaffolding of that uterus can collapse and other issues can happen. So I always like to make sure you have someone with an eye at keeping fertility intact.
Yeah, no, I mean, that if that's their job to just remove uterus and ovaries all day, yeah, they may not care about the fertility aspect at all.
Yeah, it's really, really important. And then, yeah, I think that's incredibly important. And of course, the most non-invasive to invasive is the best way to go. Anything else, Evan, you want to add on the topic? I mean, today's been really great. I think we really hit a lot of things from the nutrition aspect to some of the herbs and nutrients. Oh, just to dovetail that, progesterone's a big one. We may be adding in progesterone. We may be adding in things like chaste tree and damiana and different herbs that help modulate maca, that modulate estrogen receptor sites and or modulate progesterone and even support progesterone. And of course, we're also supporting the adrenal. So all of those key tenets there need to be fully looked at and supported. Did you want to add anything else to that, Evan?
I don't think so. There's a good handful of like female supporting herbs, things that we would typically use anyway to help with like PMS, for example, things that are going to help regulate hormone levels. Those things alone can contribute to fertility. So yeah, it's sometimes where a woman comes to us with a different problem with hormones. They may say, oh, I eventually want to get pregnant, but right now I need to focus on this major PMS. I'm out of work every week. You know, I'm laying in bed in pain. And we just help regulate hormones using some of those herbs you mentioned there, and then fix the gut, and then boom, hey, we got pregnant sooner than anticipated. Cool. Let's go ahead and kind of transition you now. Let's get you into this, maternal support phase now, and it's really fun. I tell you, there's nothing better than whether it's getting a picture in my inbox of a new baby or just a mom telling her birth story. It's fun, and it's a very, very rewarding thing, and I always. I don't know. I like to pop my collar a little bit more after I hear a good story like that, especially when a woman was dealing with the conventional medical world and she was so frustrated and so hopeless, and then she was able to actually do it naturally. It's like, yes, I told you so. I told you could do it, because the conventional doctors or OBs will be like, nope, you can't do it. You're not going to get fertile. You're too old. Your hormones are too messed up. It's not going to happen. And then boom, a baby comes. It's always just like, I told you so.
I like it. Well, after you talked about popping the collar, I'm gonna join you on that one. There we go. Excellent. Very good. So yeah, I love those stories. I think that's excellent. We always want to focus on the root cause. So just anyone listening, we want to make sure our goal is that you're looking at your fertility from a root cause perspective. If you have to bring a functional medicine doctor in, great. If you have to bring a conventional fertility MD in, great. Just always make sure you're looking at the root cause. If you have to go, more invasive on the IVF or surgery side, that's fine. Just make sure you exhaust all of the foundational options first, nutritionally and functional medicine wise. And then also make sure your husband's a part of what's going on. So make sure he's getting tested, his nutrients are assessed, he's doing all the right things on the fertility side. We can also get a sperm count on him as well. Make sure sperm numbers are good, at least 50 million. Make sure shape and morphology and all that good stuff is dialed in as well to assess that being okay. And of course, if it's not, then we have to work on all the nutrients and work on removing a lot of the toxins that we already talked about.
Yep. So get off the Mountain Dew. Oh God, we had a friend that was an old friend who was having issue with fertility, and her husband both just pounded the Mountain Dew. I'm like, who even drinks Mountain Dew anymore?
My God.
It's like 80 grams of sugar per bottle. I was like, oh, get off the Mountain Dew. So, of course, people would think everybody around you and I, like, we're just this circle of health. Our family, our friends, and everybody would just listen to us and reach out to us for help. But that's typically not how it works.
Not how it is.
So, of course, they don't ask me anything. And what do? They go do IVF. They spend, I think it was $15,000 or $20,000. They did like a fundraiser, raise money. It's like, how about just like, let us give you the workup. It's going to be a fraction of the cost, and you're going to have, minimal to no risk. I mean, like with other procedures, you could have risk of twins and triplets. I mean, they're not, death necessarily risk, but there are risks associated with some of these other things. So it's just sad. It's sad that people just don't know. And, you always say, oh, let's talk about the root cause of this. It's like, why is that so revolutionary? That should be the first way people think, but it's not.
100%. You're never a prophet in your own town. And also, if women have to go the IVF road, the goal, remember, the end goal is not just to get pregnant, right? What's the end goal? Let's huddle up and focus. What's the end goal? The end goal is to have a healthy baby, right? That's the end goal. And pregnancy is one step in that journey. So don't confuse the first step as success, number one. And then number two, if you're going to engage in more conventional approaches that don't address the root cause, I strongly urge you to make sure you're addressing the root cause. So the end goal should be having a healthy baby at the end. So just keep that in mind. Make sure you're really focused on what the root cause and goals are.
Let me say one last thing, and then I want to get your take on this real quick. So, and I love the way you said that. You know, the pregnancy is not just the end all goal. It's the healthy baby and all that. So, you know, what about if a woman does get pregnant in an unnatural method like IVF, for example, but she still has an insulin problem? I've seen cases where, and you could argue it's something else, but I would argue that the elevated insulin and the sugar and the carbs and all the crap in the diet could potentially make the baby get too big. And then the doctors are saying, hey, you know, now you've got a 9-pounder. We're going to have to do mandatory C-section, for example.
Yep.
And then there's other complications there.
Yeah, I mean, just having that high amount of insulin, gestational diabetes kind of thing going on, which a lot of times the obese don't even acknowledge really being a diet thing. I mean, I remember going in and my wife was getting testing on the blood sugar, and we were monitoring her blood sugar at home. And the nurse practitioner said, you know, hey, you know, the gestational diabetes it's a genetic thing. And I'm like, I literally pulled up a study. I'm like, it literally says more grains and trans fatty acids can actually increase it. And it was like, it was like a paradigm thing. It's like, even though like these people are conventionally trained and have to pass all these, you know, mainstream boards for their licensing, they're not really up to date with the conventional literature. And the conventional literature isn't really injected in the first line therapies for what these doctors and nurses need to know. So it's kind of sad. So we just want to bring that information to everyone on the forefront now so they're aware of it. And also, test the blood sugar, and if you're at high risk for a miscarriage, then you'd want to keep an eye on your progesterone levels as soon as you get pregnant. One of the easiest first things is using progesterone, an intervaginal progesterone, probably 200 milligrams or so a day throughout that first trimester can be a godsend for a lot of women. So if you're at high risk for miscarriage, make sure you keep an eye on testing those progesterone levels, you know. 15 to 20 or so in that first couple weeks of getting pregnant is going to be important. So keep an eye on that with your OB so you're monitoring it if you're at high risk.
Yep, well said. Well, I'm sure I could rant on a few other things, but let's wrap it up. And if people want to reach out clinically, we'd love to help you. Justin is available around the world at justinhealth.com. That's Dr. J, justinhealth.com. Me, Evan, at evanbrand.com. And we'll be back soon to talk more.
Phenomenal chatting with y'all. Have a good day.
Take care.
Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.